Good morning. Welcome back to Daybreak on this 10th day of May 2021. My name is Sam Gituku, and it's time now we want to focus on what has been informing conversations since March 2021. You're talking about the COVID-19, the pandemic that has ravaged this country. We've had several episodes of locking down, reopening. But what is important is that we've had 163,000 people infected, and more than or nearly 2,900 have died or succumbed to the complications of COVID-19. And to help us talk about that is one Daniel Yumbia, who is the Chief Executive Officer of the Kenya Medical and Practitioners Dentist Council. Good morning. And it's great to see you. But before you start the conversation, let's take a look at what that state of the war is like. Looking at the slides that we have, the numbers at the moment, we know that 1.7 million people have been tested, 1.7 million samples have been tested for COVID-19, and 9.5% of those have returned positive. Out of all these infected persons, 67.9% have recovered, and 1.8%, representing 2,895, have died out of COVID-19 complications. At the moment, the numbers that will be active cases are 49,468. Something else to look at is the hospitalization, hospital burden. We know that at the moment, 6,290, according to the Ministry of Health, are receiving care at home, or what is called home-based care. Then those that are in hospital are 1,099. This number has reduced drastically compared to what was happening previous weeks. Those that are in ICU has also reduced from, I believe, a high of more than 240 to now 133. And out of those that are in ICU, those that need a ventilator are 27. Those that are on supplemental oxygen are 81, still in ICU, but all patients that are requiring oxygen at the moment are 210. If you have to look at the monthly infections, how the trends have been over the past, well, since the pandemic began in March 2020, you will see that in the month of March, we reported 28,085 cases. That's very close to November 2020, which was the highest since the pandemic struck the country. Then in the month of April, that number should have been actually 25,000 plus, and the month of May is 4,236 that have already been reported as we speak. Something else to look at is in the fatality rate, that you'll see that the persons that have died of COVID-19 are highest in the month of April. It's 571. That's an average of 19. The highest, again, if you had to compare that to November 2020, which was the reigning highest month, was 473, but that went up by nearly 100 in April. And already the month of May is reporting an average of 19, because at the moment 171 have died over the past 9 days of the month of May. An average of 19, similar to the average in April. Then the positivity rate has been declining over the past few days, because if you have to look at how it was in March 2021, it was 14.3%, then went up to 14.7%, the highest in the history of the pandemic in the country, and now it's down to 8.8%, but still not in the 5% range that you'd say. Below that, then you would say that we are flattening the curve. Then finally, to look at the vaccination drive, you know that we have just over 1.1 million doses, but at the moment, only 916,800 have been vaccinated, and some of these are in the health sector, which I believe is about 70%, 160,933, teachers 143,000, security officers 77,000, over 58, 280,000, and others that do not belong to those categories, 253,000 vaccinations. And let's begin from there. Thank you so much for making time for us. We haven't had you in studio since the pandemic struck. You've been joining us via way of Skype. But when you look at the trends that we are seeing, we were told that we would begin to flatten the curve mid-May. Are we near? Because the average is still 8.8%.
I think one of the things that you need to appreciate is that those are predictions. And every effort is being made to ensure that the curve is flattened. Mm-hmm. I would expect a small variant in that the businesses in the 5 counties, mm-hmm. or their 4 counties, were opened about a week ago. And with that in mind, you expect people to interact a bit, and maybe the positivity rate to maybe be at where it is, or at best, or at worst, just increase by a small margin.
Okay.
With the schools also opening today, you expect another small increase. It may increase, it may decrease, but with the vaccination exercise that has been undertaken, you'll appreciate that we are almost there. So the infection rate is going down, and people are testing still, and with the positivity rate not increasing, going down in the last few weeks, few days, I think we're looking positive towards the flattening of the curve.
Right, and I think the lowest positivity rate was, I believe it was on the 4th of May, because it was at 5.1%. But on that day, 6,686 had been tested. But then again, it was low on 7th of May, which I believe was on Thursday, 6.2% on a day that 9,000, or rather, yes, 9,000 had been tested. But the number of persons tested has been declining, or has been fluctuating. What's the main
I think
reason?
it fluctuates depending on the contact tracing, because as government, we try to do a lot of contact tracing based on the people who have tested positive. We don't do mass testing, and we also do target testing in areas where we find there is need to carry out testing. And therefore, the kind of fluctuation that you are seeing is quite normal, in that people are not being told it's mandatory to test. But once you have contact tracing, then you are subjected to testing.
And that question about contact tracing, because several addresses or several releases we've seen from the Ministry of Health would indicate that there are challenges in exactly doing that, contact tracing. It's not as efficient as it was at the very start. What is the biggest tragedy that you're facing that would make it difficult to do the contact tracing?
I think the society still has not accepted that you could be COVID positive and interact with the society in a limited manner. There is still stigma for those who test positive COVID, and the society having treated them badly or with suspicion makes some people shy off from testing, and also they shy off from declaring their immediate contacts, and therefore that becomes a challenge. It is societal. It is not within the Ministry of Health failure or government failure. It is based on the society, because there's individuals who test positive. The society looks at them differently.
And you've given us different statistics of how prepared the different health facilities are in dealing with COVID-19. And we just went through a very difficult season, the month of March up to April, of a very high number of persons requiring attention in ICU, a very high demand for oxygen, even times that hospitals do not have sufficient supply. What have we done as a country to ensure that that doesn't occur again?
When the CS for Health established the National Task Force for the fight against COVID, we did sit as technical teams and made various recommendations. And health having been being a devolved function, we did recommend that counties need to be strengthened in terms of capacity and in terms of resources, and that was done. So we did recommend that each county should endeavor to ensure that they establish isolation and ICU facilities. The council, under the leadership of Dr. Eva Jenga, constituted a sectoral committee which went around the country and inspected all the facilities that were set up by the counties in terms of isolation. And these are facilities where patients suffering from COVID would be isolated. We also did carry out an evaluation in terms of the ICU facilities that were there, and we advised them appropriately that they were not sufficient. I can say for quarantine facilities, we were up above board, that we established enough. And remember, schools had been closed, and we had the advantage of using most of the Kenya medical training colleges and some learning institutions to establish the quarantine facilities. That was okay. When we went to isolation facilities, which required basic preparations, where people could get basic care, and they required healthcare workers to match the demands. And when we went to the issue of ICU beds, that we did indicate that we were far below the expectation. And counties were given resources by the National Treasury to set up up the setup of the ICU facilities. As we speak, we must say that there is no patient who is waiting to be admitted. But 2 months ago, a month ago, we had challenges where patients could not access ICU facilities, and they would only survive on supplemental oxygen, which would be given in the setup facilities. So I must say that we have contained the situation in as far as ICU demand is concerned, but it was quite a challenge. And that as a country, we accept that setting up an ICU unit is not a cheap affair, and also getting personnel devoted for the ICUs. But COVID has also had its own advantages in that counties now have set up ICU facilities which will be used beyond COVID. So we should not look at it like these facilities will only be used for COVID. As soon as we are done with the COVID, then patients would be able to access ICU services within their counties, which is a big plus compared to the situation as it was before then. Even
though when you look at those facilities, we almost failed the test, because the test came between March and April, and a lot of deaths were also reported. Like you see from the numbers, 571 people died. Maybe those persons could have been saved. But when you look at the evolving nature of the virus, and now the Ministry of Health indicating that we reported a couple of cases in Kisumu County, how much of a concern is this, especially looking at the complications? Have they been seen to turn the way they have turned in India, here in the country? I don't think we need to be scared so much. The variant that was detected in Kisumu is under control. We did send a team, and their contacts were traced and subjected to testing, and fortunately very few turned positive, as you are aware. Therefore, it means that the variant had not spread much to the country. The only challenge is that when they came in and they traveled to Kisumu, that was something that could have been contained, because our instructions were very clear that anybody arriving from India prior to the closure of the flights, they were supposed to be tested at the airport. Probably those ones came before the deadline, and that could be a challenge. And once we closed the flights, we suspended flights from India, and anybody who came between that period, they were subject to testing. I do believe that the situation is under control. Okay, and Nyumbia, let's talk about your personal story, because you've been at the front line, setting strategy, checking out on how well the government is doing in its facilities, and then the virus hit you. What was that? This is a personal experience, and I'm happy to share it out for the sake of other people to learn that COVID is here with us. It can get anybody, and personally, I was prepared to get COVID. I must say that it was not when I get COVID. It was not if I get COVID. It was when I get COVID. Up from the beginning, I was a bit worried when the first case was reported. And as soon as it was reported, within a week, the council was declared the National Command Center for Isolation and Quarantine, which in essence meant that I was going to work throughout. As much as I would have wished to rest, like any other person who is above 58 years, I was subjected to be in the office, actually longer hours
than was expected. And we did set up a command center that was monitoring the travels, and we were in charge of quarantine. Remember, we were quarantining people who had traveled out of the country, and I would take time and visit these quarantine sites periodically, of course, with a mask and using a sanitizer like any other person. So that was the first time that I felt that it was a matter of time, because I was getting to close contact with people who were probably, and when we conducted tests at some of the isolation centers, you remember quite a number turned positive.
Right.
So I still had secretariat, which was handling the number of doctors and healthcare workers who would visit the council from hospitals and so on. And remember, we also carried out an exercise of verification of isolation centers in the country. In as much as I did travel much, I sampled a few centers, and that also gave me some exposure. So for me, I was psychologically prepared that at some point I'll get COVID because of the work, the nature of work that I was doing. But
so when did this happen, and what symptoms are you experiencing?
Come February 8th, February 2nd, 3rd, I got some headache, persistent headache, and got nauseated, and some slight fever. For me, when I got the headache from the 2nd to the 7th, it was an headache, persistent headache. I consulted my physician, and they prescribed painkillers, and they thought it was just pressure of work initially, because it didn't look serious. Then come 8th, I developed nausea, and I consulted my physician, Professor C.F. Otieno, and before then I had discussed with a particular hospital. I would say we had discussed and agreed with them that when I get COVID, I'll be admitted there. That was the preparation I'd made. Of course, personally, I had not even involved the family. I'd informed my doctor and the hospital that when I get COVID, I should be given a place which was different from the isolation ward for COVID. It was a special place that had been prepared. So my doctor suggested that I proceed to the hospital, but during the day I had gone to see a chest physician because I was having some difficulty in breathing, and he's actually recommended that I do a COVID test. I organized somebody, Lancet came and picked my samples from the office at 3 o'clock. And remember, picking samples at 3 o'clock meant that the results would be out at night. So they fast-tracked and told me by 8 o'clock I have the results out. And I decided to go home at around 5:30. On my way home, I called my doctor and said that nothing has changed, and I was having some serious headache now, and I was feeling completely nauseated. I realized I had not taken anything, and I was not angry, and I was not feeling like I needed anything. So he said, my advice is now we meet at the place we had agreed. Let's meet at the Nairobi West Hospital. Then I went to the hospital. I checked in. And as in the process of checking in, it took some time, but by 8 o'clock, of course, the hospital also took their samples for COVID, and by 8 o'clock, I got my results, which were positive for COVID.
How was that for you?
Well, one, for me, it was good that it was discovered it was COVID, that it will be managed now as COVID, not like something which is not known. But to the family, it was shocking news.
Right.
They didn't take it lightly, and therefore they panicked. And I was put in hospital, and the situation in the hospital is one which is everybody should be prepared. Once you get COVID and you are put in isolation, you are on your own. You are on your own. If you are a believer, you are there with your God.
So how long did it take for you in the hospital, and did it get worse?
Yes, the first 5 days were okay, but on the 5th day, I developed breathing challenges, and I was advised that I have to be put on supplemental oxygen, which ranged between level 2 to level 3. By the time they were putting it on level 3, I had panicked a bit, and I felt that the world was coming down on me, and I resorted to prayer. I did conduct a very close family friend in the U.S., Elizabeth and her husband, and we got into prayer.
Right.
The reason why I resolved to seeking divine intervention is that I was just confined in one place, and I had stopped watching news, and I had stopped even my social media handles. I was basically enclosed, and only prayer, and I had my Bible.
So what was your oxygen concentration at that time?
It had gone to 80, I think it was 85.
85.
85.
Of course, not so bad comparing to other patients. So what for you worked so that you're able to get out of dependence on oxygen and eventually recovery?
I think there is a certain medication, remdesivir, which was given together with the dexamethasone, vitamin C, vitamin D. I think those are the combinations that really assisted. But after remdesivir was administered through IV, on the first day, the second day, there were challenges in my veins accepting it. And the situation became worrying when the nurses said that they could not get the veins, rather my veins were shrinking. And that was on the night of the 13th of February. That is the night I got scared. Because they struggled, they got the ICU doctor. I thought they were going to take me to ICU. And that is when my physician arrived, CF Otieno, and he fixed the line, but he recommended that following day I would have to take my medication orally. Okay. Come change of, on the 14th, change of the medication from IV to orals, then I started vomiting.
Whoa.
Again, I didn't know what to do, because now veins have a challenge, IVs have a challenge, and the medication is having a problem. So I still talked to Evans and Elizabeth from US, and they told me in the US they tried those patients who were vomiting were also having energy drain, and the recommendation, some of the procedures they were using is taking the medication using Lucozade.
And it worked for you?
It worked for me. It worked for me for 3 days.
Okay.
I could do that, and then eventually I recovered. What I did mostly in the hospital, besides prayer, is exercise.
Okay.
They created room for me to exercise, and I was able to walk at least for about 20. I started with 15 minutes, went to 20 minutes, up to 30 minutes to 40 minutes, every day twice. Okay. And that I continued even after being discharged. But upon discharge from hospital, I got another problem. I developed insomnia. Because I was in hospital for 2 weeks, and again I stayed home for another 3 weeks without going to the office. So it was more than a month that I was out of office. I developed insomnia, and therefore I could not sleep. And that when discussing with my doctor, I was advised it was a side effect of dexamethasone, and therefore I was started on a regime that would detoxify the medication. But now you're okay? I'm quite okay. I've been back in office now for the last 3 weeks.
When did your negative test come in?
When I was in hospital, I tested negative. And after staying in the house again, I tested again. One thing that the hospital did for me, they gave me dedicated nurses, only two. One at night, one during the day, because of infection. But when I went home, because I got a few visitors, and people kept on seeing me, a few people kept on seeing me, I felt I needed also to be tested. So I've made it a routine that I've tested. After recovery, I've tested about 3 times.
Okay.
That I just want to be sure.
Just to be sure that you're negative.
But having been tested positive, negative again, I got the vaccine. And that is also giving me a lot of faith that I'm waiting for my second dose.
Okay.
And once I get my second dose, it will be okay.
Right.
What I would like to say is to appeal to to society. I think we have a duty to accommodate patients who test positive of COVID. They need a lot of psychosocial support.
Okay.
Because that aspect that people are being neglected is true, is real, and it is important that once you get somebody who tests positive, as long as they are protecting themselves, they have masks, they are sanitizing, and you are not interacting directly, it's good to give them that support. That love is required for people to recover post-COVID, also to integrate in society and live together. Daniel
Yumbia, thank you so much for your story, and well done. I mean, we are happy for you. You've been very instrumental in helping us understand some of these matters, even as you continue with your national duty. And Daniel Yumbia is the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council. He has been here sharing on the latest in the fight against COVID-19, as well as sharing his personal story. We now want to take a short